Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a May 28, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 5 new COVID-19 cases since my report yesterday. As of May 28th, Dubuque County has 334 positive COVID-19 cases. That's a rate of 345 per 100,000 population. I'm sorry to report 2 additional deaths for a total of 18 deaths in Dubuque County. 5,060 people have been tested in Dubuque County, and about 7% of the cases tested have been positive. 8 individuals are currently hospitalized, and 155 people, or about 46% of Dubuque County positive cases, have recovered to date. 845 Dubuque County residents have had serology, or antibody testing. 53 of those, or 6%, have tested positive for COVID-19 antibodies. The state added 213 cases since yesterday. As of May 28, 2020, Iowa has a total of 18,573 positive cases. In all, about 1 in 22 Iowans have been tested, and about 13% of Iowans tested have been positive. 14 additional deaths were reported in the state since yesterday for a total of 504 Iowans. And 46% of all Iowa deaths due to COVID-19 are in those 80 years old and older. Currently, 345 cases are hospitalized around the state, and 10,313, or 55% of Iowans, have recovered. As more data becomes available in Iowa and the U.S., I've been giving some different statistics. One is the rate per 100,000 population. This is a way to compare different geographic areas with each other while accounting for the different populations in each area and comparing based on a rate if all the areas had a population of 100,000. So if we compare the state of Iowa with the other states in the U.S., Iowa has the 12th highest number of cases per 100 population. We can also do comparisons with testing. In Iowa, Dubuque County has the 3rd highest rate of testing per capita among counties with populations over 50,000. Dubuque also has the 6th highest number of cases per capita in the larger populated counties, even though we are 8th highest in population. The Dubuque County Public Health Incident Management Team is advising groups and organizations how to hold safe summer activities, sporting and recreational events. As we plan, let's not let our guard down just because businesses and communities are opening up and just because the weather is turning to warmer summer temperatures. We have zero knowledge of COVID-19 being a seasonal disease. In addition to widespread transmission in countries and parts of the world with much more warmer temperatures than the U.S. has experienced the last couple of months, we haven't even made it through a full year, a full cycle of seasons, yet to even begin to predict the seasonality of COVID-19. Any seasonal predictions occurring now are based on our historic experience with influenza every year. But differences and migrations are occurring in the northern and southern hemispheres, which means this virus could be maintained for next year. So even though we don't have enough information to make COVID-19 predictions for the fall and winter, planning should begin now. We won't have a vaccination this fall, and it's doubtful we will reach a 60 to 70% infection rate to create herd immunity by then. So public health measures and mitigation strategies will still be necessary. Keep that in mind as you're seeing what works and what doesn't in the upcoming weeks as we try to resume some of our activities at 50% capacity rates and with public health measures. In closing, let's not be short-sighted in dealing with COVID-19. It's always been a struggle for us public health professionals to convince people to think long-term. Take smoking, for example. We've been saying that smoking causes lung cancer and is one of the top causes of death and illness since the 1960s. But still, more than 1 billion people worldwide are tobacco users. As former CDC Director Thomas Friedman recently told the Washington Post, the problem is people putting the present ahead of the future. So as we continue to think ahead, let's all be safe, be smart. When in doubt, don't go out. And remember, we're all in this together.